trauma-specific skills are also going to be really important therapist skills because trauma is fairly ubiquitous. There's a lot of the understanding collectively of trauma sort of focuses around massive disasters or accidents, violence, physical or sexual violence, war, these types of things. Whereas actually trauma ought to be broadened to also incorporate relational developmental trauma, such as the trauma of neglect, which has profound impacts on human beings, as well as other social circumstances and conditions of extreme stress, such as racism and other forms of marginalization that cause enduring states of stress that cumulatively end up having an impact, a traumatic impact on a person's functioning. So when we consider trauma and its near ubiquity, maybe not PTSD as a very specific diagnosis, but the symptoms of historic trauma, maybe outside meeting that narrow diagnostic criteria, but trauma symptoms and where they show up, it's quite widespread. And it's possible, I think it's the statistic is somewhere near 1 in 2 women have experienced sexual trauma, for example, or violation. So it could be expected that under the influence of a psychedelic in a non-ordinary state, specific elements of historic trauma may emerge into the therapeutic space, whereas in ordinary states of consciousness, there might be defensive mechanisms or otherwise mechanisms of the psyche that have walled off those experiences from consciousness for good reason, because when the trauma happened, by definition, it was overwhelming. And if something's overwhelming and a person doesn't have the resources available to navigate through that safely and successfully, it's common that there can be even memory repression because it's just too overwhelming for the psyche and the emotional self to integrate at the time. So under psychedelics, traumas may surface. And I believe that it's really important for us to not only understand human attachment, but to also have some skill sets that relate to understanding the psychobiology of trauma and how that shows up physiologically and emotionally, perceptually, behaviorally for individuals, such that we can support resourcing and support expanding a person's capacity to be with experience and to expand the depth and the height of a person's access to different states of nervous system arousal, whether that be sympathetic or parasympathetic. As with trauma, it tends to narrow. And there's specific techniques and skills and ways that we can work in therapy that really do support that. And beyond the scope of this presentation, however, I do believe that it is an important skill set to also think about training in or having some skills in delivering psychedelic-assisted therapy.
This mini lecture is part of Nuances' Introduction to Psychedelics, which is a free course where we explore the world of psychedelic medicines and their potential as therapeutic tools. Check out the link in the description for more info.